John, what brings you to the Franchise for Humanity?
Well, it's an interesting sort of serendipity in that a good friend of mine here was already speaking and mentioned it to me and thought that I might be interested, and Mei Lin, who leads the conference, wanted to have someone who could speak to some of the issues surrounding healthcare and the framework for humanity. And I am working with a group of folks to develop some sort of out-of-the-box notions that resonate well with the objective of this conference. So my major interest in coming was actually to meet more people like me who were very interested in really taking advantage of the exponential technologies that we're all benefiting from and applying that systematically and deliberately towards solving some of the larger issues that face us as a civilization.
So what are some of the issues that you're involved in?
Well, the thing that I'm most involved with is the historic shift that's going on in healthcare now. I already made a decision over 20 years ago to leave the fee-for-service world and go work for an organization that fosters prevention and preventive care and focuses more on wellness, that being Kaiser Permanente. But what I'm working on more recently is the next historic shift. So that was an invention of Sidney Garfield, the founding father of Kaiser. What I'm working on now is something he couldn't have imagined in his vision 50 years ago, and that is how the internet and mobile technology have enabled every individual person to be much more actively engaged in their own health and wellness and prevention and health care and disease care. And so what's happening in the world as we speak is what I refer to as a plecosystem that's helping contribute to what I call a behavioral symphony for wellness. And what I mean by that is that there are many, many new exponential platforms and technology, whether it's the web itself, mobile technology, genomics, big data analytics, artificial intelligence. There's about a dozen different technologies that are advancing at exponential pace that can all be brought to bear both to help the provider provide better care, but for the individual person themselves to have a much better understanding of their opportunities to enhance their own health and wellness. And so what's been missing to a great extent in the healthcare system and what is happening right now is that the mobile, social, web-based technologies are allowing us to extend knowledge and services to individuals where they live, work, play, learn, and worship. And in that construct, we are also beginning to understand what are the behavioral economics and the tools of using some of these mobile technologies to help people reach their own goals.
So you're saying that the shift in medical practice is mostly about information management and information gathering as opposed to a shift in medicine itself?
Not precisely. There is that shift occurring right now. I see that as table stakes. So what's happening is the access to information is becoming less a secluded privilege of the professional and more an accessible tool for the many. But because of that, we now have the capability of empowering individuals to take much more control. And so we need to look much more at what are the behavioral cues that help us make healthy decisions. So when I refer to the behavioral symphony of wellness, what I mean is that we're learning what tools work for different individuals to help motivate them towards their own goals. So the information helps educate them about their options and opportunities to improve their health. The behavioral tools help them attain their goals within their value set. So the fundamental shift is the role of the physician and the healthcare team as being the primary source of guidance and health information is shifting. There's much more self-service and there's much more collaboration and shared decision making. So the so-called patient-centric or consumer-centric or better yet person-centric model of care empowers the individual with information as well as with tools to help them select which option is best for them in terms of their aspirations, and then to reinforce that with their micro decisions where they live, work, play, learn, and worship.
Now, the U.S. has one of the most expensive healthcare systems in the world. Is there something about that that needs to be fixed? We have all this fancy technology, and we have social networking and easier access to information, but costs are still totally out of control. Is that caused by some other issue?
It is actually, and it's kind of interesting. It's a direct consequence of one of the unintended consequences of governmental intervention. So back in the early 70s, when we had wage and price escalation and inflation, the policy was to put caps on wages and prices. And the only way that, with fixed wages, the only way that employers could compete for employees was through benefits. And so what happened was this huge shift from the individual paying for their health care to the employer paying for their health care, and that disempowered the individual and empowered the professional community to essentially exploit the payment mechanisms. And then subsequent to that, the fee-for-service model, where the payment was so skewed towards procedures and away from prevention and health and really solving the larger problems of what creates health and wellness for an individual, that we've actually gotten what we've incentivized. A lot of people think that the healthcare system is behaving irrationally and that's why it costs so much. Quite the contrary. It's behaving very rationally, but to a very perverse set of incentives around substantial reimbursement for the procedures and the volume of things done rather than the quality of outcomes. That's one of the reasons that I personally left the fee-for-service world and joined Kaiser Permanente, was to enjoy an environment where a focus on prevention and wellness is more valued than a focus on doing more procedures. So that's one of the causes. There are other causes that include end-of-life care. So we have this sense of entitlement that we want and need absolutely everything until our very last breath. And we're kind of an outlier among other nations in that regard. So that's not a medical problem, it's a social zeitgeist kind of problem.
Is it a question of, well, how much do we value life? How much is it worth it to spend of public money to enable somebody to live another few months, for example? I mean these are questions of values and trade-offs.
Right, and it's a very active dialogue among philosophers, ethicists, policymakers, but what I will tell you, here's a very interesting statistic. If you look at the average person who ends up in the hospital and you say, okay, here's your situation, imagine that you're ending up at this point in your life where you're on a ventilator and your prospects for significant, meaningful recovery are significantly compromised. And you put that same context to a physician who treats people in the hospital. 80% of the people who are not physicians will look at that scenario and say, I want everything done. 80% of the physicians would say, no, would you please just let me die peacefully and not put me through all those extraordinary and often uncomfortable measures. So there's a gap in understanding between the professional community and the average person in terms of what it means to do everything up to the bitter end, not just in terms of cost, but in terms of prolonging agony, in terms of unsatisfying experiences. And so a lot of what we need to do with end-of-life care is to educate people so that they actually understand what they're asking for.
What do you hope to gain from the conference? What are your aspirations regarding the outcome of this event?
I've already exceeded my expectations in terms of finding other like-minded people who are really highly motivated to change the world, to put a dent in the universe, as Kimberly says, and who are makers and doers rather than philosophers and strategists. And I've met many people here already who actually have made a significant dent in the universe and who continue to think out of the box about what the exponential possibilities are for improving the health and wellness of our communities. I just wanted to add one thing to your last question of, what is occurring that's different and in healthcare. And a lot of what's happening is that our genetic heritage of scarcity has collided with an abundance. And our behavioral cues are driving us towards very unhealthy lifestyles, and hence the epidemics in obesity and diabetes and all the direct but secondary consequences of cancer and stroke and heart attack and so forth. And so one of the true imperatives about achieving health and wellness is around educating and motivating, and particularly on the motivational side, because everybody knows it's not healthy to eat fast food all day and not exercise and not sleep enough. But finding ways to motivate people to overcome that collision between the behavioral cues and the genetics of our the environment of scarcity in the past and the environment of abundance right now. So that's yet another factor that is driving up healthcare costs, is this epidemic of obesity and diabetes related to disorders of lifestyle, and yet it is very amenable to tools and interventions that help restore a healthier state at lower cost.
Okay, very good. Thank you very much.
Great, thank you.